medication. I have the patient's chart here, so I'm just going to make sure that the medication, the drawn up amount is right, this is the right patient, and the route of administration is right, which it does appear to be. This is the right medication. It is pulled up to 0.2, and this is the right patient. I'm just going to make sure there's no bubbles in this syringe. Now I have my assistant holding off, and he's holding off the vein. I'm just going to moisten the site with alcohol so I have a good view of the vein, and also to disinfect a little bit. Okay, I'm going to introduce the vein, or the needle into the vein, bevel up. And I am holding my other finger there for support. So I have that flash of blood there, and then if you'll let go of pressure, I'm just going to slowly give that, and then I'm going to hold off the injection site so that there's no hematoma forming or any problems. And that is how you do an IV injection on a cat. Okay, buddy. Should we hit a blood vessel? So I'm going to insert the needle in her back skin area here. I'm going to lift it up and make it bent. I'm going to insert the needle, bevel up. And then I'm going to lightly pull back just to make sure I didn't hit a blood vessel. I don't get any blood. And I've already bled this line, so there is fluid all in this line. And have my assistant hold the fluid glass, so I'm just going to slowly give it. So we're doing a cephalic catheter today. I have my supplies, my tape, gauze if I need it, my catheter, T-set, chlorhexidine scrub and alcohol, flush, wrap, and clippers. So first I'm going to clip the leg. going to flush the catheter with the Tepronite flush. And the T-set. And then I have my 3-chlorhexidine and 3-alcohol, so I'm going to wipe the area. And Rebecca's already started holding off so I can see the vein. I'm just going to wipe my fingers off so they're not so slippery. So I test the catheter just to make sure it's not going to burr or mess up on me. And I can visually see her vein right here. I'm just going to measure and see where the catheter is going to lie. Once I get a blood flash back, just feed the catheter. I'm going to hold off just so it's not a bloody mess. I'm going to dispose of this. And tape. This is my anchor piece, just to make sure the catheter is not actually having contact with the skin. Place this T-set and anchor that as well. I might have cut this a little too big. It's a wrap. Anchor my T-set. And then flush. We did put an 18-gauge catheter in her. She's a larger dog, so wanted to get it as big as we could. Possible complications and things to look for when you're replacing and taking care of a patient with an IV catheter. So some problems that could occur, clipper burn being one. You want to hold the clippers as flat to the skin as possible. You always want to make sure that your actual blade isn't very hot. It can get hot when the machine is on for too long. Clipper burn can lead to increased inflammation, which then can lead to a bacterial infection. It's also going to increase the chances of the patient licking or chewing at the catheter site. So that's something you want to try to avoid, and if it is there, you want to try to help it along or try to make it more comfortable for the patient. Another problem that you could see is phlebitis, which is an inflammation of the vein. With this, you'll see swelling, tenderness, redness, things like that. If you're seeing this, you want to let a doctor know right away, possibly, and probably are going to have to replace the catheter. Another thing you can see is infections. You're going to see all of those things that you see with phlebitis, accompanied by a purulent discharge. So if you're seeing all of those things, you're seeing a yellow or green discharge from the catheter site, you definitely want to take it out, replace it, and get a fresh new catheter site, and treat whatever is going on. Another thing you can see is thrombosis. So that's when the vein's actually standing up without being held off. It also can look like cord-like. So if you're seeing that, you definitely want to let the doctor know. Most likely you're going to take that catheter out and put a new one in. Some other things to look for when you're checking the catheter, you want to check for patency. So flush the catheter with heparinase saline. Make sure you can feel it above the catheter and that the catheter is still within the vein. You want to make sure there's no exposure of the catheter. So if you take the tape off and you notice a little bit of the catheter is actually sticking out of the skin, you want to make sure to push that back in and then flush to make sure that it's still patent and you're still able to use that catheter. Another thing to look for when you're checking catheter sites is any swelling distal or proximal to the catheter site, any tenderness or anything like that. If the paw is swollen, then most likely the tape around the catheter is too tight. You need to loosen that up a bit. If it's swollen above the catheter, most likely you're not in the vein any longer and you're just giving fluid subcutaneously or, God forbid, medication subcutaneously, so you need to definitely let somebody know about that immediately. Check for patency, flush the catheter, see what's going on. Some precautions that you can take for keeping a patient from licking or chewing at a catheter site would be an e-collar. That's going to be your easiest and best decision if you have a patient that's definitely going to go at it. Put an e-collar on. That's going to keep them completely away from that catheter site, and you're not going to have to worry about the patient getting it out. You can try using certain products that are supposed to keep the patient from licking the area. There's like yucks and things like that. They have a very potent smell or awful taste, so it's supposed to keep the patient away from licking or chewing. But I would say 9 times out of 10, I would just place an e-collar, and that way you don't have to worry about it. As far as heparinase saline goes, the textbook amount to give, or textbook solution, is 1,000 units for 250 mils of saline, or 4 units per mil. So when you're using heparinase saline, you want to make sure that you have that correct solution. Otherwise, you're either giving too much anticoagulant or not enough that you're not even going to be really helping the patient and not forming clots around the catheter. So those are some things to look for and things to do when taking care of a patient with an IV catheter. So I'm going to be placing a medial Taptis catheter today. I have all of my supplies, my tape, my vet wrap, my catheter, an injection port, heparinase saline, and my scrub, as well as my clippers. So she's in lateral recumbency. I'm just going to clip the area.
The cornerstone's been running slow for you guys too. We did the survey last night. No, I know I would. She'll be on 20 an hour in surgery, please.
That's all my sterile towel over here, which I'll use after I clean it. So I'm going to clean the area 3 times with scrub and alcohol.
We're going to shave you? Yeah. I took that down. I'm not going to handle the 6 days anymore. I mean, that's like, oh God, yeah.
Flush my catheter with heparinase saline.
He was so good, he just had to just pass it.
I'm going to insert my catheter bevel up. Wait for that flash of blood and feed the catheter in.
Why are they doing that?
And then place stop. And then going to tape the catheter in.
I see it. I shouldn't believe you.
Place my vet wrap.
So as I come in and I say this is like prayer, never mention your name or anything like that.
And then I'm going to flush with 2 cc's of sterile, heparinizing.
And then I thought maybe they'd never ask me again, but they did.
And I can feel it in the vein.
No, it's been for several hours.
So that's how you do a medial saphenous cap. I'm going to be doing the Schirmer tear test. So I have my little strips here. These are actually marked with the measurement, so I don't have to measure them after I place them in her eye. So I'm just going to do the left eye today. So I'm going to remove the test with being very careful not to touch the end that's going to be in her eye. And now for a dog, 15 millimeters or more is normal. For a cat, it could be as low as 5 millimeters or more, that's normal. So I'm going to place this between her lower eyelid and her cornea, sort of in the middle of her eye, and then keep her eye closed. And I'm going to measure for 60 seconds. Good girl. Almost done. Almost done. All right? Good girl. So her measurement is about 20, which is normal for a dog, and you can see the strip here. So I'm going to go record this. Her left eye has normal tear production, and I'll let the vet know. I'm going to be applying eye medication today. I have the patient's chart here, definitely this patient. This is the right medication. Also, it is to be applied to the eye. So all of that is good. I have gauze if I need to wipe his eye. So I have my assistant holding. We're going to place his head a little bit up. I'm going to apply the medication by holding his eyelid up and applying onto the sclera. You can also do it by pulling his eyelid down and applying it to the conjunctival sac. He has really long eyelashes, so it's a little difficult to do it that way. So I'm going to remove the nozzle. You never want to apply the medication directly to the cornea because that can cause pain, especially if the medications are cold. So I'm just going to lift up the eyelid. And I'm going to do this very carefully without applying or touching the nozzle to the patient. Alright, and then I'm going to close his eyes just to distribute the medication evenly. Okay, and that is how you would apply a medication to an eye. I'm going to be doing the fluorescein stain today. I do have my pre-drawn out stain here, some gauze for when I flush her eye and the eye flush. I also have my ophthalmoscope to look at her eye once the stain is in, but I'm going to keep that up there so it's not on the floor. So I'm going to start by having my assistant hold her. I'm going to lift up her upper eyelid, and I'm going to place the drop in her bulbar conjunctiva. So I'm going to lift up her eye and place one drop. Let her blink a couple times. Good girl. And then I'm going to place a little gauze underneath of her eye, and then I'm going to liberally flush out that eye so any stain that's not didn't uptake gets flushed out. I'm going to clean off her fur. Okay. I'm going to go shut the lights off. And I'm going to be examining her eye for any stain uptake. So if there is any uptake, that means she has a corneal ulcer where it did uptake. And I don't see any stain uptake. It looks very clear and normal. Another thing that you can examine when you're doing this is their nasolacrimal ducts. So if their nasolacrimal ducts are working and functioning properly, then the stain will actually come out of their nose, which hers are. So with this procedure, you're able to examine the eye, make sure there's no ulcers or corneal ulcers, but also you're able to check to make sure her nasolacrimal ducts are functioning properly. So everything looks good with her, and that is how you stain an eye. I'm doing the ton of pen today to get intraocular pressures. So I've got the ton of pen here. You want to make sure that it's working properly and that it's clean. There is a new little tip on there, so that is good to go. I'm going to do the pressure paint on both eyes, being careful not to actually touch his eye when I put it in. And I'm going to let that work for 30 to 60 seconds so that it's actually working properly when I go to do it. So as I'm waiting for that, I'm going to calibrate this. So I'm going to hit the button twice and wait for it to say calibrate. And then once it says up, okay. So I'm going to start. I'm going to do it on the cornea. I'm just going to lightly tap it. 21. 12. And 16. Okay, so I got 21, 12, and 16. So I'm going to add those all together and then average them out. So the average is about 16, which is normal for a dog. Generally for dogs and cats, it's between about 10 and 20. This test does test the intraocular pressure of a dog and a cat. And if you did have an increased measurement, most likely that's indicative of glaucoma. So that is how you do tonometry. So I'm going to be applying a modified Robert Jones bandage to his front leg today. So to start off, I have my assistant holding and lateral recumbency. If he were to have a wound, which he does not, but if he did, I would place this non-adherent pad to the wound site. The reason for that is just to keep the bandage from sticking to the wound so it has better wound healing. And I would also be very careful when I open this not to touch any center part of the pad that's actually touching the wound, just for so I'm not causing any infection or anything like that. So the next thing I would do is apply stirrups. I did already pull some stirrups just to measure them out first. You can apply them laterally and medially or caudally and cranially. I'm going to be applying them to the top and the bottom of the foot, or caudally and cranially. So I'm going to start this side. Good boy. I'm going to apply this side. And then I'm going to place a tongue depressor in between just so that they don't stick together. going to start with my calf padding, starting at the distal end, but not covering his toes. So I'm going to start doing, and you want to make sure you're covering at least 50% overlapping, and you also don't want to do this too tight. And I'm going to apply 2 layers of this. Okay. Next, I'm going to do my conforming gauze. This I'm going to do a little bit tighter, but you still want to make sure it's not too tight. So I just want to make sure that this is not, I can still, fit my finger under here, and it's not pushing too much on his leg. Still, again, starting at the distal end. So as I'm pulling this around, I'm just kind of pulling it so that it has some, it's just a little bit tighter. And again, you want to wrap this at least 50% overlapping. You don't want this tight by any means, but you want it tighter than the last layer. Okay, and you do only have to apply 1 layer of this. I'm just going to cut this. Okay, and next I'm going to take my stirrups. I'm going to pull them up, twist them, and tape them to the gauze. And you do this so that you can see the toes. You want to make sure throughout the time that your dog has a bandage that his toes are never swollen, they're never hot to the touch, they never are red or have any strange odor. So I'm just going to check his toes. You can see them there. Trying to make that tape stick. So next I'm going to do my vet wrap. I only have to do 1 layer of this as well. And sometimes to make sure that this doesn't end up going on too tight, you can unroll it and re-roll it, just so you're not pulling so hard to get it off of the roll. So again, starting at the distal end, same thing, overlap at least 50%. You're wanting to make sure that your bandage is not too tight this whole time, making sure you're not applying it and going to restrict any blood flow or anything like that. Okay, so now that the bandage is applied, I'm just going to check his toes, making sure that there's not any redness, swelling, or anything like that. And then we can let him get up. And you just want to make sure the leg is in a normal position, so he's able to bend it and have use of it while it's in the bandage. And you can see his toes do extend from the bottom of that. Okay? And that is how you apply a modified Roberts-Jones bandage. I'm going to be doing the dental today, so I'm going over the dental instruments that we So I have them all set up here. These are the periosteal elevators, which we'll use if we need to remove any teeth. We have a dental mirror, not really used all that much, but we have it just to have it. These two are both supragingival scalers, so they do have that pointy end that you cannot use subgingivally. So we have those to scale the crown of the teeth. This is our subgingival curette. You can see it has see if it'll focus, more of a rounded end. It's not sharp and pointed, so that's a more gentle instrument to clean subgingivally. I also have my dental probe with the graduated measurements on it, as well as the Explorer on the other side. We'll use the probe to measure the gingival sulcus to make sure there aren't any pockets, and if there are, we will measure them, see how deep they are. This is the calculus removing forceps. We will use that to remove large chunks of calculus from the teeth. We have this as a mouth gag to keep the mouth open. We have some thumb forceps as well as a scalpel blade holder, needle drivers, and hemostats if we have to remove any teeth. The doctor will use these for suture and things like that. We have our water and air here, so by pressing these buttons, this is what I'll use to rinse the teeth, or if I needed to dry to, pack a tooth with antibiotic or what have you. This is our drill, and the drill bits are here, so we would use this to cut up a tooth to remove it from the mouth. This is a dental angle with the disposable prophy cup. We'll use this to polish the teeth. And then this is our ultrasonic scaler. This moves at high frequencies to break up the calculus on the teeth. That is also only to be used supragingivally. You don't use this subgingivally like the scalers because it can cause damage. So that is all of our instruments that we're going to be using today. And next we'll go on to safety. Your dental safety, to start with me, I have to wear gloves, a mask, and goggles. The reason for that is you are breaking up all this calculus, which is going to be allowing bacteria and residue in the air. You don't want to inhale that or it to get into your eyes. So the mask so you don't inhale it, the goggles to protect your eyes. Also, if you're removing any teeth, using the drill to cut the teeth up, it can fly out of the mouth. You want to make sure you have those on. And then the gloves just to protect your hands so you're not touching all that stuff. Also, you want to make sure you have a correct endotracheal tube with a properly inflated cup to prevent aspiration. And you also want to have some gauze or sponges in the back of the mouth to absorb any liquid, but to prevent any debris from getting down into the throat. Also to prevent aspiration. We also have rolled up towels here that you're going to place the head and neck of the patient over. This will keep the head in a downward position so gravity won't allow the liquid to go down the throat. So again, to prevent aspiration, to prevent debris, things like that, from going down the throat and in turn hurting the animal. So that is safety. We're done. Okay, so we're actually going to be cleaning his teeth now. He does have an endotracheal tube and his cup is inflated. So I'm going to start with a precursory exam. I'm just going to feel for his submandibular lymph nodes, see if he has any enlargement as well as his salivary glands. Which I don't feel anything. Next, I'm going to look at all the tissues of the mouth, soft part, palate, tongue, gingiva, tonsils, everything. I'm looking to see if I have any growths or masses, any pigmentation or discoloration. And I don't see anything unusual. I'm also going to check for any retaining deciduous teeth, any fractured teeth, or any use the ultrasonic scaler. I'll show how to use this, and then I'm going to use the ultrasonic scaler. So I'm only going to do this supergingivally. I'm not going to clean subgingivally, because that can cause damage to the tooth. So I'm just going to, in a firm but gentle motion, move down towards the crown to scrape the calculus off the tooth. Okay, so that's how you use the manual scaler. I am going to use our ultrasonic scaler for this. So you don't want to leave the ultrasonic scaler on any portion of the tooth for longer than 10 to 15 seconds. That can cause damage by making an unnecessarily deep groove in the tooth, or cause damage by the heat that it would cause. And you also always want to keep the scaler parallel to the tooth. So I'm going to be moving up and down towards the crown of the tooth in an overlapping motion. And this, like I said, you don't want to do subgingivally because you can cause damage to the tooth. rinse it out a little bit. So now I'm going to use our subgingival curette. So this has the rounded edge, and I'm just going to carefully place it underneath the gum and scrape down towards the crown of the tooth. He does have some gingivitis, so he's bleeding. Alright, I'm just going to go over all of them one more time to make sure I got anything out. To polish his teeth, I have my Profi paste here. So I'm just going to put a little bit of paste into the Profi cup. I'm going to make sure I don't stay on the tooth or a single tooth for more than 2 to 3 seconds because the friction that this causes and the heat that it causes could cause damage to the pulp of the tooth over time. So I'm going to, on a low speed, just gently. I'm going to try to get slightly subgingivally without causing any damage.
Alright, so I'm going to put this out there, Richard. If we start getting bombarded with questions,
Yeah.
take it down, right?
Yeah. Can you give me an FDA, please?
You do want to be careful with a dog like this when they have the hair. You can get caught up in it, so just be very careful. And what this does is it does try to cover up any scrapes that I made on the tooth with the scaler, which would be a great surface area for plaque to build up on. This is trying to combat that. I'm going to rinse again. You want to make sure you're rinsing away from the back of the throat. Okay, so now I'm going to be doing the probing and charting. So I basically want to make sure that each gingival sulcus isn't deep. I'm checking for any pockets. This probe is graduated with measurements. Each segment is 3 millimeters. So I'm not getting anything deeper than 3 millimeters at the moment. He does have some gingival recession on that canine.
There's no chart on his test. There's nothing on the PBL because he wrote a check.
He has a slight pocket on this one incisor.
And he keeps saying it never seen that or something.
So I'm going to chart this. And this is the upper left quadrant.
Yeah.
Charting the teeth. He does have a 4 millimeter pocket on that second incisor.
Well, sometimes they're giving it to me and
Some gingival recession on his canine. G is gingival recession, O is missing, X is extracted. So I'm going to write G on 204.
All the receipts.
He's missing 206 and 207.
All of it in one, no staple the checks in there. Those should just, any checks and cash should be loose in the
So I'm going to put an O on 206 and 207.
Yeah.
Okay. Okay, so what do you want me to say?
I mean, if he's okay with it, he doesn't think we ran it through. I mean, it could take me
And he's missing 210. So I'm going to put a 0 on 2 or an O on 210.
I could look at that leak of deposit, so we'll still have to pull it up on the back.
Okay.
Okay, it's
So I'm going to rinse once more. And once he's finished, he does have some some more teeth to be cleaned, you just want to make sure you clean up the animal, brush it out, get any Pro-P paste out of its fur, make sure that he's presentable to mom and dad when he goes home. And that's how you do a dental Pro-P on a dog. So the last thing with a dental is the importance of writing up a dental discharge instruction for the client. So I have my written up dental discharge here. It is for the dog that we did, Teddy, the dental on. So it goes through that he had a dental today, he may be sore or tired, restrict his activity, he needs to be fed soft food for the next 1 to 3 days. It says please give the medications here. He was sent home with an antibiotic, which is just to be started tonight. And then home dental care, it says don't begin brushing for 1 to 3 days just because you can cause more inflammation or uncomfortable for the patient. And then they may have some bloody saliva for the next 24 to 48 hours. He didn't actually have any teeth extracted, but it does go through if he has sutures, it needs to be removed. It may need to be removed if necessary in at least about a week. These are the instructions for the client to take home for the patient. Like I said, it goes through that he may be sore or tired, he needs to restrict his activity for a couple of days, he may have some bloody saliva or discharge. He didn't have any extractions, so we won't have any needs to come back for suture removal. He did go home with some antibiotics, so you'll need to start those tonight. And basically just keep an eye on him, and if there's anything that you're concerned about, just give us a call. We're going to be showing the technique on how to clean the teeth today. So I have my model here and all of my instruments that I'll need to use. So to start with the calculus removing forceps, you want to place this flattened piece behind the tooth, the curved piece in front, and pull it down towards the crown of the tooth. So you want to use this for large pieces of calculus, and I don't want to pull too hard because some of these teeth are really loose. For the really large pieces of calculus that the ultrasonic scaler and hand scaler aren't going to get off as easily. So you just pull down towards the crown of the tooth. Next I'm going to do the curette and the hand scaler, and you can see the difference in these two. This one here is the hand scaler. That is sharpened, it has the beveled edge. This is only to be used supragingivally, you do not use this subgingivally. Where this one is your curette, it has that rounded edge and the beveled edge. It's a little bit more gentle on the soft tissues, and that's why you can use it subgingivally. So to start with the hand scaler, basically you want to get from the top of the tooth, not subgingivally, right at the line of the gum, and just move down. And you want to do that in gentle but firm motions towards the crown of the tooth, breaking off those pieces of calculus and scraping off the calculus. So you just want to go to each tooth and drag it towards the crown of the tooth. You can also use an ultrasonic scaler for this. This vibrates at high frequencies. You never want to leave this on the tooth for more than 10 to 15 seconds because it can cause a deeper than necessary groove and also cause damage from the heat that it would occur on the tooth because of it moving so quickly. So you just want to, as it's on, move in parallel motions towards the crown of the tooth, making sure to always keep the scaler parallel to the tooth and breaking off that calculus. This is also not to be used subgingivally. You only want to use this supragingivally. So next I have my curette. Basically what you're going to do with this is gently slide it underneath the gum and then move in very quick and soft motions towards the crown of the tooth, breaking up anything underneath the gum line. So you just want to slide it underneath and pull down towards the crown of the tooth. Next would be our dental angle with Pro-P cup. So this would have Pro-P paste in it. This isn't an actual dental, so I'm not going to do that. But basically, you want to move this parallel along the tooth. You don't want to keep it on one spot of the tooth for more than 2 to 3 seconds because the heat that would cause, the friction, could actually cause damage to the pulp of the tooth. So you just want to place, this would be circulating, you want to do that at a low speed. You do want to push down a little bit towards the gums, that way you can get a little subgingival polishing, and you just want to polish around the tooth like so. And you want to make sure you do get all surfaces of the tooth to try to fill in those scrapes that the ultrasonic scaler and hand scaler make. Okay? And next would be the dental probe and explore. Basically, this is a graduated dental probe. It does have the measurements. Each graduation is 3 millimeters. So you want to place this into the dental sulcus and measure each sulcus to make sure you're not having any pockets or anything like that to be concerned about. So you want to place this parallel to the tooth. You want to place it underneath the gum and just gently push to make sure that you're not getting, you don't have any gingival loss or anything like that that would make the patient have pockets. So you would just go around each tooth, making sure that you don't have any pockets. And that is the technique on how you clean a patient's teeth. Okay, so next we're going to be going through the different kinds of teeth and then also the different teeth surfaces. We'll start with the surfaces, and I have a diagram here that's written just to show. So this is the top of the mouth, this is the bottom. I also have a model here. So what it's going to be is there's incisors on the front, so you have 6 total, 3 upper left, 3 upper right, 3 bottom left, 3 bottom right. Then you're going to move on to your canines, which are these larger teeth. You have 4 total in the mouth, so 1 upper, 1 lower on each side. Next, you're going to move to your premolars. So on the top, you have 4 premolars. So there's the 1, 2, 3, 4, and then you have 2 molars. On the bottom, you have 4 premolars and 3 molars. So those are the different types of teeth that you'll see in a mouth. As far as the different surfaces, so to start, distal is going to be the back of the teeth, so the teeth facing the back of the mouth. So this is the distal portion of the canine, this is the distal portion of the 4th upper premolar. So that's where any teeth facing the back of the mouth, that's the distal portion. Mesial is going to be pointing towards the front of the mouth. So this part right here of this canine, this part right here of this canine, that is the mesial surface of those teeth. So they're facing the front of the mouth. The next is going to be lingual or palatal, depending on if you're on the bottom or the top. So lingual are going to be these bottom teeth here. They're facing the tongue. So the back of these teeth here facing the tongue, the back of these teeth here facing the hard palate and soft palate. So this is the palatal surface of these teeth. This is the lingual surfaces of these teeth. Last would be the buccal. So that's going to be the outside of the teeth facing the buccal or the cheek. So the buccal surface of the teeth are all of this outer surfaces. So those are the different surfaces and the different teeth that you'll see. Okay, so next we're going to be going through the dental formulas for a dog and a cat. I have the book here that shows the different formulas. This one is for the dog, this one is for the cat. So basically, 3 and 3, that's 3 upper, 3 lower of incisors. 1 and 1, 1 upper, 1 lower canine. 4 and 4 is 4 upper, 4 lower premolar. And then 2 and 3, 2 upper, 3 lower for molars. You do multiply this by 2 because you have 2 sides of the mouth. And then the total number of teeth a dog should have is 42. So that is the dental formula for canines or adult canines. This is the dental formula for adult felines. So they have less teeth, 3 and 3, that's 3 upper, 3 lower incisors. The eye there is the incisor. 1 and 1, that's 1 upper, 1 lower canine. 3 and 2, 3 upper, 2 lower premolars, and 1 and 1, 1 upper, 1 lower molar. They have 30 teeth total. So they have less premolar teeth and less molar teeth in a feline cat. So those are the 2 different formulas to go by, and each are going to multiply the total number by 2 because you do have 2 sides of the mouth, and that is the different formulas. Okay, so now we're going to talk about why dental radiology radiography is really important. For one, it can show the involvement of bone and teeth, especially when neoplasia or metabolic disease is suspected. It allows you to evaluate the mandible and maxilla to make sure that you don't have any bone loss or anything abnormal with the teeth themselves. It also helps when you have root damage or anything to do with the root that you can't see with the naked eye, so you're going to be able to see if you have any problems, if the tooth needs to come out, things like that. Like I touched on before, it's going to help you see bone loss, so if you have severe periodontal disease and you take an x-ray, you're going to be able to tell if the tooth has a lot of bone loss or if it doesn't actually need to go out, it just has a lot of calculus present. You can just break it off and clean up the mouth. It's also helpful when you've done dental extractions to make sure that you've got the full root of the tooth. So you take x-rays beforehand to make sure the tooth actually needs to come out, make sure there's bone loss, things like that, and then you take it after to make sure that there isn't any retained root, there isn't anything left of that tooth, and you can close up knowing that there wasn't anything left and that everything's okay. Alright, so we're going to go through the problems that you can see with a patient's mouth. First off being calculus. So that is a buildup of plaque on the tooth that calcifies, and it eventually will lead to periodontal disease. That bacteria will get under the gums and cause problems, decay, tooth loss, gum loss, things like that, gingival recession. So calculus is something you're definitely going to see on a regular basis. Older dogs are going to be worse than younger dogs, but it is genetic sometimes. Some dogs just have awful teeth, where other older dogs don't. So it's going to be something common that we come in contact with in general with mouths and dogs. The next is going to be periodontal disease, so caused by calculus. There are 4 stages of periodontal disease from moderate to severe. Basically that's that buildup of bacteria from the plaque. It gets under the gums and eventually can make its way to the bloodstream. This can actually affect the heart, kidneys, and liver. So periodontal disease isn't just a disease of the mouth once it gets severe. So that's definitely something that you want to take care of. It sometimes cannot be reversed, so you want to take care of it. Prevention is the best treatment, but do what you can for that. The next are going to be fractured teeth. So that's something that you see when dogs or cats, I suppose, chew on hard things like rocks or sticks. Basically, the tooth itself is broken. Sometimes you can get fractures that don't really reach the interior of the tooth, but if you do have fractures that reach the pulp, you definitely need to take care of that. You most likely are going to have that tooth extracted. There's really no other treatment. You can do endodontic treatment, but generally speaking, if a canine or feline that has fractured a tooth, that tooth needs to come out. It can be painful, so it's best for the animal in general to just take it out. Next thing is going to be worn teeth. So you see that a lot with dogs, especially if they love a tennis ball, they chew on a lot of things all the time. You'll see that wear down of the teeth. It's not as severe as a fracture because it does happen gradually over time. It can make its way to the pulp of the tooth like a fracture. So same treatment. If it's bad enough, the tooth most likely will have to come out. You can do endodontic treatment with that one as well. But basically, when the tooth is wearing down, the dentin can't keep up, and eventually the pulp of the tooth will become exposed. So the next thing are retained deciduous teeth. You really only see those with puppies and kittens when the teeth don't fall out. Generally, they say by 6 months they're not going to fall out. That can lead to problems like malocclusion, or it can make periodontal disease more severe. So you want to make sure that when they're getting spayed or neutered, that you take those teeth out, and that way you don't have to deal with any of those problems. The next thing is going to be a tooth root abscess. So this is caused by severe periodontal disease, or it can happen when there's a foreign body caught in a pocket in the tooth, so if the gingival focus is deep enough and the foreign body can get into there, it can cause tooth abscess, or tooth root abscess. This does cause pain and actually can cause the patient to stop eating altogether. So this is something severe enough that most likely you'll need to go in immediately and take that tooth out and deal with the infection that's there. So that's something you sometimes see. It's not incredibly common, but you want to keep an eye out for, especially if a patient has stopped eating and they have awful periodontal disease. The last is going to be an oronasal fistula, most common in canines. Basically, you see that when there is a pocket or advanced periodontal disease on the palatal side of the canine. So basically there's a problem with that canine tooth and you take the canine tooth out because there's severe periodontal disease or what have you. And then there's actually a hole that communicates from the nasal cavity to the mouth. It sometimes is unavoidable, but you want to try to do everything you can so that doesn't happen. But that is something you can see with patients with severe periodontal disease. Okay, so the importance of home care and letting your patients and clients know how to deal with it at home is going to be the most effective treatment, if you will, because prevention is better than treating severe periodontal disease. So to start, brushing the teeth is going to be the most important and best way to prevent periodontal disease. They recommend it at least once a day, and you want to start in the front of the mouth, work in circular motions to the back of the mouth. You want to let the clients know the most important part of the teeth to be brushing is going to be right there at the gum line to try to help that bacteria from forming. That way you don't have the problem in the future of the bacteria getting under the gum line, causing gingival recession and bone loss and periodontal disease, things like that. So toothbrush and toothpaste. You don't have to use toothpaste, but sometimes it makes it easier for the dog because I think it's a treat versus a punishment. You want to make sure you do not use human toothpaste because the fluoride is toxic to cats and dogs. So you want to use a canine or feline toothpaste that's fluoride-free. This one here is made by Verbac. It's the enzymatic toothpaste. It's poultry flavored, so it makes it a little bit more fun for the patient. Next thing you could do is chew toys or chews in general. These are Oravet chews that are also made by Muriel. So they're little chews that you give to the patient. Basically, they are supposed to reduce bacterial or reduce the bacteria from forming and also reduce plaque from sticking to the teeth. These work. There's nothing better than brushing the teeth, but if you can't do that, if you have a patient that just won't let you, this is better than nothing. It will help in the reduction of bacteria, and in the long run, I'm sure it helps somewhat. Like I said, nothing like brushing, but it's something that you can do. There are also things like dental diets that you can get. Purina makes some. It's called DH. It's just a larger kibble, so the friction caused by chewing that kibble is supposed to help with periodontal disease. I'm sure it works some. It's not going to be as effective as brushing. It's better than nothing, but there are those options out there as well. So home care is definitely important. It's going to help in the long run. Do what you can, and I would, just make sure that they know the importance of it and how it could help them and their dog or cat in the future.